BLS Final Actual Exam, Basic Life Support, version 2 newest. Question 1. How does the process of defibrillation actually work on the human heart? It shocks a stopped heart to start pumping again. It temporarily boosts blood flow through a stopped heart. It stuns the heart to stop ventricular fibrillation. It restarts the heart and creates a new electrical rhythm. Contrary to popular belief, defibrillation does not restart a heart that has no electrical activity, asystole. Instead, it delivers an electrical current that stuns the heart to momentarily stop the chaotic, non-functional activity of ventricular fibrillation, VFib. This pause allows the heart's natural pacemaker to resume a normal, organized rhythm. Question 2. What is the clinical definition of cardiac arrest? When the heart begins to beat irregularly. When the heart stops effectively pumping blood. When cells in the brain start to die due to lack of oxygen. When the body does not breathe properly. Cardiac arrest occurs when the heart's electrical system malfunctions and the heart suddenly stops beating effectively. This results in the immediate cessation of blood flow to the brain and other vital organs. It is different from a heart attack, which is a clogged pipe or circulation problem. Question 3. What is the primary difference between clinical death and biological death? Clinical death can only be pronounced in a hospital. Biological death occurs when organs can no longer function or be revived. Clinical death occurs only after 10 minutes of CPR. Biological death occurs the moment breathing stops. Clinical death begins the moment the heart stops beating and the victim stops breathing. However, this state is potentially reversible with BLS. Biological death follows within minutes when excessive brain cell death occurs and the organs are no longer capable of being revived, even with advanced medical intervention. Question 4. Approximately how long after cardiac arrest do brain cells begin to die from lack of oxygen? 1 minute, 4 minutes, 6 minutes, 10 minutes. The brain is the organ most sensitive to oxygen deprivation. Brain cells begin to die approximately 1 minute after the heart stops pumping blood. After 4 to 6 minutes, brain damage is likely, and after 10 minutes, the damage is typically irreversible. Question 5. How much blood is moved during high-quality chest compressions compared to a normal heartbeat? 15%, 30%, 45%, 60%. High-quality chest compressions are a manual substitute for the heart's pumping action, but they are not as efficient as a healthy heart. Even when performed perfectly, compressions only provide about 30% of the normal blood circulation, which is why maintaining the correct depth and rate is so critical. Question 6. If BLS is not initiated, how much does the chance of survival decrease for each minute following cardiac arrest? About 2%, about 5%. About 10%, about 20%. Time is the most critical factor in cardiac arrest survival. For every minute that passes without CPR and a shock from a defibrillator, the victim's chance of survival drops by approximately 7% to 10%. Prompt bystander intervention can double or triple the chances of survival. Question 7. CPR involves 3 basic steps. What is the correct CAB sequence according to the American Heart Association? Breathing, circulation, airway. Airway, circulation, breathing. Airway, breathing, circulation. Circulation, airway, breathing. The AHA changed the sequence from ABC to CAB circulation, airway, breathing, to emphasize the importance of chest compressions. Starting with compressions ensures that blood is immediately circulated to the brain and heart, rather than delaying compressions to open the airway and give rescue breaths. Question 8. Which cause of cardiac arrest is statistically most common among older victims? Electrocution, choking/foreign body obstruction, underlying heart condition, respiratory distress. While trauma or respiratory issues are common causes in children and young adults, cardiac arrest in the elderly is most frequently the result of underlying cardiovascular disease, such as coronary artery disease or a previous myocardial infarction. Question 9. Which of the following is not a valid reason for a rescuer to stop performing BLS/CPR? A valid DNR, do not resuscitate, order is presented. An advanced life support, ALS, team arrives and takes over. A defibrillator, AED, is not immediately available at the scene. The victim shows clear signs of ROSC, return of spontaneous circulation. Once CPR is started, it must not be stopped unless the rescuer is physically exhausted, the scene becomes unsafe, a professional of higher training takes over, a legal DNR is produced, or the victim recovers. The absence of an AED is not a reason to stop, manual compressions must continue. Question 10. When is it appropriate to place a victim into the recovery position? When you first arrive at the scene and find them unresponsive. Only if the victim has a pulse and is breathing normally. Immediately after delivering the first AED shock. If you need to leave the victim to call 911. The recovery position, lying the victim on their side, is used only for unresponsive victims who have a pulse and are breathing effectively on their own. This position helps maintain a clear airway and prevents the victim from choking on vomit or their own tongue while waiting for EMS to arrive. Question 11. What is the rationale for performing chest compressions on a firm, flat surface? It prevents the victim from becoming dizzy. It makes it easier for the AED to analyze the rhythm. It improves the delivery and effectiveness of the compressions. It is only for the comfort of the rescuer. Compressions must be performed on a firm surface, like the floor or a backboard, so that the force of the push actually depresses the chest. If the victim is on a soft surface like a bed, the force of the compression is absorbed by the mattress, and the heart is not adequately squeezed between the sternum and spine. Question 12. In an unresponsive infant, what is the first step of the CPR process after checking the scene? Check for a radial pulse for 10 seconds. Provide 5 back slaps and 5 chest thrusts. Give 2 rescue breaths with a mouth-to-snout seal. Begin chest compressions immediately. For infants, children, and adults, the protocol is CAB. If the infant is unresponsive and not breathing, or only gasping, the rescuer should immediately move to chest compressions. In an infant, these are performed just below the nipple line using 2 fingers or the 2-thumb encircling hands technique. Question 13. Which condition can occur if artificial ventilations are delivered too forcefully during CPR? Hypoglycemia, gastric distension, pulmonary edema, tension pneumothorax. Gastric distension occurs when the stomach becomes filled with air. This is caused by rescue breaths that are given too quickly, too forcefully, or without an adequately opened airway. This can lead to vomiting and aspiration, and the distended stomach can push up on the diaphragm, making lung ventilation more difficult. Question 14. What does the acronym ROSC stand for in emergency cardiac care? Rapid onset systemic collapse, return of spontaneous circulation, respiration of oxygen and sodium chloride, reflexive outward stunted contraction. ROSC, return of spontaneous circulation, is the goal of resuscitation. It occurs when the heart starts beating again on its own, providing a palpable pulse and blood pressure. When ROSC is achieved, the rescuer should monitor the victim's airway and breathing closely while preparing for post-cardiac arrest care.